BRT is the bioactive response technique in 30 minutes. The results are less pain, tension, and interference, and more full life expression. It includes gentle chiropractic, osteopathic, acupuncture, myofascial release technique, movement therapies, sound, and light therapies. Between the lower back and the feet, we have all kinds of muscles that will be reflected in the status of the lower back. We could assess for tone, that is the tension, resistance, would you raise your leg up, the whole leg up, and for range of movement, and this one. And it seems like there's maybe possibly a little bit more resistance here. We can go down to the legs, especially the calf muscles, so we could simply press in here. This is an access point, and that is already sensitive. So now we have some information to keep in mind as we proceed with the treatment. So it's a little assessment, a little treatment, little assessment. And I would ask for some feedback. Carol, is there any difference here? One way or the other?
The left side.
So it's more on the left side. The sciatic nerve goes down here. Something here, like possibly there's some adhesions and trauma to the tissue here as it anchors the lower back muscles into the sacrum. And here's a very, very key area. It reflects on the abdominal area. And rolling over this feels more like cord-like and part of this tension pattern. The stomach energy channel runs from the foot and all the way up into the neck area. And the best way to connect the dots, I've found, is to have 2 points, always going from one point to another. I can quickly assess the energetics of some major channels like gallbladder, stomach, liver, and spleen and pancreas. And you could feel the difference, especially when you're going from comparing one side and the other. We could also assess the overall fascial pull. Fascia is kind of like pulling on your sweater in one place and noticing how it moves, you know, throughout the whole fascial network. And this side, see, it feels a little different, doesn't it? Yeah. And then, of course, there's the key points, like stomach and gallbladder, and assessing the, as we go up, assessing the psoas muscle, a major player in lower back ease or dis-ease. So go ahead and bring your knee up, and let me go ahead and move it this way, and it feels okay. Does it feel okay to you? Mm-hmm. Yeah. It's a little, doesn't the pelvis want to kind of go along this way? Yes. So there's a little something on that left side that does seem to be something, as we know, we can include that with what we found when you were laying face down. The abdominal area. There are key reflexes in the abdominal. Find abdominal reflexes. Here, right along the diaphragm muscle. And it feels okay. Here, maybe less than okay. So there's some, to me, it's a kind of congestion. We want to go to the shoulders. It's a quick way to assess the shoulder, rotate the cuff, capsular ligaments, bursa, tendons. It's a complex joint. And potentially vulnerable to injury because we have so much mobility here. We could assess the other 6 major meridians. We could assess the heart, pericardium, the capsule of the heart, and the lung channel. Here's a really nice point for the lung. The large intestine, the triple warmer, which has to do with the fascia of the respiratory area, the abdomen, and the elimination organs, and the small intestine. This is a gua sha tool that I could just pass over the fascia, which can bring up almost like a stethoscope, checking for heart rate. You could feel that there's a little congestion, little almost grittiness sometimes, and in this area, and particularly on the top of the arm. Yep, so you feel it right there?
I do.
Yeah. So what it means is that the blood could be cleaner. The digestive organs can burn, with more fire and more completely. Going down the menu of our usual suspects for food triggers, we can think about milk. And it could even be half and half in coffee. So think about half and half. Okay. So there doesn't seem to be any reflex. Now, think about wheat. The next most common suspect. And look what's happened. There's been a very clear shift as this muscle contracts, bunches up in a guarded way. It's information that the digestive organs have already seen because this is really in memory. And the experiences of stress digesting that food. So now the body becomes guarded to protect itself. My primary, you might say, treatment effect is simply rolling over tissue and let it reset. Rolling over and let it reset. Then giving space so the body can respond. We could use the various, salves, just a lotion, so it makes using cups more comfortable. I find these cups great. They seem to really change the quality of fascia almost instantly. So I like when things are accomplished painlessly and quickly. So we could move it around, and we could even, kind of draw a little bit like that. And that actually usually is enough, and it is indeed. So we can use red or infrared. Usually red is a good stimulating color for the lower energy center. So red is like this. And we could place it over an important mechanical fulcrum for moving the pelvis, and that would be the lumbosacral area. Usually within about 3 or 4 minutes, we're able to accomplish the maximum benefits. More blues, violets as we go up. So we're going really from lower frequency to higher frequency. It's the overtones from acoustic sound where the body can respond best. Healing with the overtones. Two tuning forks with an interval of 5. From lower to higher. I'd like to assess lower cervical and upper cervical and around the head area. If there's impingement or interference to this nerve, usually here, then you're going to change the normal regulation of those areas, the heart, lungs, and digestive organs. Again, it's a matter of enough, but not too much, either pressure or qualities of touch. We always want the mind-body to feel safe and following and hopefully trustful. So I'd like to introduce a specific movement so the body can chunk down to that area. And we could just do that a few times, and there was already a shift. I always like to ask myself, what's the least amount? Because if it's less, then the body somehow can have more power to make that change. I believe in the intelligence of the body. What I'd like to do next is to run by you some common stressors. So, put your arm out, hold real strong. We have established you have no problem. It's like on. I could just see, oh yeah, you're there. So put this, in your hand or next to your body and hold real strong. No problem. Hold real strong. No. And this is more represents fungus which includes candida, infection. And hold. Okay, so let's go back to detox. Let's see if that could be upgraded. Okay, and hold. A little something. So there you go. Finally, I'd like to assess more in the field of gravity, how freely Carol moves. I usually have to, you might say, refine this tuning up. So again, apply the same techniques, rolling over and giving enough space for Carol to respond and reset. Now would you turn your head again? See if there's any, oh yeah, there you go.
Better.
Yeah, okay. Anyway, we can help to return to a state of ease, more freedom, and a sense of being energized and being the best version of what we can be.